Hello everyone. Next topic is breast pathology part 2. Let's start this chapter. Here we discuss the breast tumors. Breast tumors are divided into two categories: benign tumors and malignant lesions. In the benign category, most common is fibroadenoma. So we'll discuss the fibroadenoma in detail. Second is phyllodes tumors, and third is intraductal papilloma. We already discussed about the intraductal papilloma. Next category, the malignant lesions. Here, in short, the malignant lesions are divided into three. First, the carcinomas, then phyllodes tumors. Phyllodes tumors may be benign, may be borderline, and may be malignant. And third is sarcoma, then lymphomas, and metastatic tumors. We'll discuss. Let's start with the most common condition, fibroadenoma breast. Proliferation of epithelium and stromal element. This is the definition of the fibroadenoma. Word cell fibro means stromal component, and adenoma means glandular component, means epithelial cells. So here the proliferation of both epithelial cells along with the stromal element we get. This is the most common breast tumors in adolescent and young adult women. If the young patient around the 20-30 year of age and come to you with the palpable mass, well-defined mass, the most common tumor which is suspected is fibroadenoma. The peak age incidence is third decade, means 30 years of age. It's mainly higher incidence occur in the black patients. Grossly, it's well circumscribed, freely mobile, non-painful mass. If the patient comes to you with when you take the clinical history, patient complain of the mass lump she detected. It's freely mobile and it's well circumscribed. In the fibrocystic changes we discussed about the lesion is a painful and the cyclical pain is there, and it's ill-defined mass, irregular mass. But here is a mass is freely mobile, well circumscribed, and the painless mass. There is no history of the pain in this patient. Clear? Next, if it's untreated, then it regrets by own, or maybe the patient requires the surgery. Okay, if the large in size more than 3-4 centimeter, then surgery is advised. If it is small, less than 2 centimeter or around 2 centimeter, it regrets by own with the hormonal therapy. Ducts, microscopically, histologically, we divide this fibroadenoma into two patterns according to the arrangement of the ducts. The ducts distorted, elongated, slit-like structure is present, then we known as intracanalicular pattern. And when the ducts are not compressed, the dilated cystic ducts are visible, we known as pericanalicular pattern. Okay, it's a little practical value, means there is no clinical importance, no surgical importance in this. Just on the basis of the histological pattern, we say is the intracanalicular and pericanalicular pattern. We never write in the report either it's a pericanalicular or the intracanalicular. Just on the arrangement, if the slit-like ducts are there, we known as the intracanalicular. If the dilated or cystic ducts are there, we known as pericanalicular pattern. Okay, what you get in the USG in the fibroadenoma, here is a very important USG findings. So you have to understand by this. Benign lesion and the malignant lesion. By USG you can say is a benign lesion, probably benign lesion, or the malignant lesion. Okay, then final diagnosis on the histopathology we know, but on the USG you can see here is the horizontal mass, the black mass. You can see here these are the stria of the fibrous tissue. Here is a round to oval this mass is there, and this homogeneous, there is no calcification, no markings are there, the well defined borders, and the mass is there. So this is benign condition and more horizontal. What happened to malignant lesion? Malignant lesion are more vertically placed, and because of their go into deep, they invade the tissue, and the horizontal oval mass, round oval mass is present on the USG and well circumscribed homogeneous mass. So most probably it's a benign lesion, and most common benign lesion in the breast is a fibroadenoma. So on the basis of USG you can say it's a benign lesion. Okay, next is mammography. How we diagnose the cases? First, the clinically we discuss the well defined mass is there, painless mass. Okay, freely mobile mass. Then USG we find the horizontal mass, well defined oval to round horizontal mass without any change irregularities in the mass. Now comes to the mammography. This is a case of the large fibroadenoma in which you can get the density. What we see in the mammography, first the density and second is the calcification. So you can see there is a mass, large mass with a dense area with a large calcification. In the malignant lesion, we get the small, irregular calcification, but you can see here the clumps of the calcified material. Large calcification is the finding of the giant fibroadenoma. Now comes to the gross of fibroadenoma. Here, this is a left side is a benign lesion, and this right side is a big lump, well circumscribed, white in color, tan white, fibrous tissue. With somewhere you can see there's when we enlarge this picture, you can see there's a multiple slit-like spaces, lines are there, multiple slit-like opening is there. This is a typical gross picture of the fibroadenoma. Well circumscribed, no pushing borders, and the slit-like openings, white to tan in color. Now comes to the microscopic findings of the fibroadenoma. First thing, it's a well circumscribed tumor. There is no invasion. You can see the capsule on the one side, and then these are the proliferation of the ducts and the stroma. Centrally, there is a loose stroma, and then surrounded by the dense stroma. Here, on the left side, there is a slit-like ductal structure. Two layers of the on this side you can see here the cells this side. This is the side where the slit like ducts are there. The ducts are compressed by the fibrous tissue and the double layer of the ductal epithelial cells are seen. This is known as the intracanalicular pattern. And here on the lower corner you can see there is some little bit of the open ducts and surrounded by the loose and then followed by the dense stroma. This is a pericanalicular pattern. So in the single slide you can get both the pattern, intracanalicular pattern and the pericanalicular pattern. And second, the fibroblastic stroma enclosing the duct structure, and these ducts are lined by the single double layer of the epithelium. Outer layer is a myopithelial and inner is the epithelial lining. This is the microscopic picture of fibroadenoma. This is very important for your practical purpose also. Second benign lesion, benign tumor is intraductal papilloma. Here the proliferation of papillary fonts within dilated ducts. Okay, this mainly involve the large ducts beneath the nipple, really palpable, small palpable mass, but most common clinical presentation is bloody nipple discharge. And intraductal papilloma is the most common cause of bloody nipple discharge. You should remember this line. Okay, here is a gross and the microscopic picture of this intraductal papilloma. We already discussed in the previous lecture. See, here is a large duct. In the gross picture, you can see the large clot section of the breast tissue. The large duct filled with this papillary structure, and there is areas of hemorrhage also. When we see this, when they cut this section and we see microscopically, you can see this is an open ductal cystic structure, the dilated duct, and the papillary formed fibrovascular core and the proliferation of the ductal epithelial cells. So this is the intraductal papilloma. Next is lactating adenoma. Okay, this is another benign tumor of the breast, mainly commonly seen during the lactation or pregnancy. There is enlargement of the mass occur during the pregnancy. If the small fibroadenoma are present in the breast in the female, then they enlarge during the pregnancy. They forms the lactating adenomas. They have the prominent secretory changes. On the basis of their secretory changes, we can diagnose this easily. So there we get the multiple ducts and filled with the secretions. Okay, this is a gross appearance of lactating adenoma. Here the mass has a distinct lobular configuration, yellowish color, and marked vascularization. We know that during the pregnancy, vascularization and the density of the breast is increased little bit. Breast become the heavier because of the excessive congestion and the milk formation. So in the lactating adenoma, you can see the yellowish color and marked vascularization also. This is a microscopic picture of lactating adenoma. What is difference from the fibroadenoma? In the fibroadenoma, we see the clear picture. There is no secretion, no excessive density of the gland. But here the numbers of the gland is much more because of they are lactating glands. So multiple acini are there. They lined by the myoepithelial and epithelial cells. and there is a very less stroma fibrous tissue, multiple dilated ducts, and the few of the ducts you can see on the left. You can see here this duct is showing the multiple this is on the corner, the large duct, dilated duct with the secretion, mainly they are the milk secretions. Okay. The hyperplastic lobules shows marked cytoplasmic vacuolation. So this cells are showing the vacuolation, the lining of the cells. You can see that there is the cytoplasmic vacuolation, benign nucleus, and the cytoplasmic vacuolation in the glands, in the ducts. Clear? This is a case of the lactating adenoma. Next category is tubular adenoma. After fibroadenoma, then intraductal papilloma, third is lactating adenoma. Now comes to the tubular adenoma. Tubular adenomas are far less common than fibroadenoma. Age of presentation, again the young woman. Here we get discrete, freely mobile mass like similar to the fibroadenoma. On the basis of histology, we can say it's a tubular adenoma or fibroadenoma. How? In this tubular adenoma, we get the multiple small ducts. They are closely packed ducts, uniform size duct, but there is no secretion. Like in the lactating adenoma, we get the multiple ducts with the they filled with the secretion, but here the ducts are the clear, no history of lactation, no history of the pregnancy, but we get the picture like a lactating adenoma, multiple small duct without any secretion. So this is labeled as tubular adenoma, but it's very rare. Next category is cystosarcoma phylloides, or also known as phylloides tumor. Initial description over 150 years ago: fleshy tumor, leaf-like pattern, and cyst on cut surface. Okay, they are well circumscribed. They have the pushing borders in which the connective tissue and epithelial elements are there, but connective tissue is more in density compared to the epithelial component. Epithelial component is similar to the fibroadenoma, but the connective tissue cellularity is more, greater connective tissue cellularity. Size varies from 1 to 15 centimeters, so it's maybe the very big. We have to differentiate this from the giant fibroadenoma. If the giant tumor is there, but excessive connective tissue proliferation compared to the epithelial component to and the typical leaf-like pattern on the cut surface in the microscopic slides, then we labeled as phylloides tumor. They are less than 1% of the breast tumors. They may be benign, they may be malignant, maybe low grade and high grade malignancy, maybe borderline. Local recurrence is more common compared to the metastasis, and metastasis can occur in the malignant phylloids, the hematogenous metastasis. Here in the first picture show the mammographic finding. Okay, the fibrous neoplastic neoplasia, which is pushes out the tissue. You can see it's coming like appear like this, coming out from the breast tissue. So it's the pushing borders are there in the mammography, dense without any calcification here. Histologically, this is a histologic slide. This is a histologic slide of the phylloides tumor. Sorry, you can see in the upper side there is a pushing borders. They appear like the leaf-like structure. They form the typical pattern of the leaf-like structure. Some slit-like cystic openings are there. Cytoplasmic ATP and mitotic figures are very rare. Okay, epithelial leaf-like typical leaf-like patterns. Okay, this is a microscopic and the mammographic finding of phylloides tumor. Clear?